Good morning, everybody, and welcome to the campus COVID-19 briefing. Please note that live captioning and ASL translation will be available this morning, and the recording will be posted later today on my website. When we post the recording, we include timestamps that go to each topic or question that was addressed, making it easier to find the information you're most interested in. Today, we'll be going to about 11 a.m., and we'll get to as many questions as we can. And you can ask questions, of course, using the Q&A function. Today, we're joined by Provost Susan Collins, Vice President for Student Life Martino Harmon, Rob Ernst, a physician who leads our Campus Health Response Committee and is Associate Vice President of Student Life for Health and Wellness and Executive Director of the University Health Service. Katrina Wade Golden is Deputy Chief Diversity Officer in the Office of Diversity, Equity, and Inclusion. Emily Martin, an Associate Professor of Epidemiology in our School of Public Health and a member of our Campus Health Response Committee. Marisa Eisenberg, an Associate Professor of Epidemiology in the School of Public Health and an LSA, and she's an Associate Professor of Mathematics and Complex Systems, also Interim Director of the Center for the Study of Complex Systems. Additionally, she's an expert consultant to the Campus Health Response Committee. Adam Lauring, an Associate Professor of Internal Medicine and Microbiology and Immunology in the Med School, an Associate Professor of Ecology and Evolutionary Biology in LSNA, will be joining us today for the first time, I believe. And then our ASL translators are Marciano Gongora and Laura Clark. First, I'd like to bring in Dr. Ernst and Martin to discuss what we're seeing on campus and the work of the CHRC. Rob, can you give us the latest summary of conditions across campus? Good morning.
Good morning, everyone. Well, the headline in MLive this morning, I think, captured what's happening. The U.S. as a whole is feeling some relief from the recent sort of surge in cases attributed to the Delta variant, but unfortunately, Michigan's among some of the states that's seeing a sort of progressive increase right now. I think while that trend is true across the state, it's affecting different counties in a variable way based upon their vaccination rate. So Washtenaw has been comparatively affected, with more, it has had a more gradual pattern of increase. The progressive decline in cases we've seen among students has leveled off at a low level now. We're still at very low levels of test positivity, both for our asymptomatic surveillance as well as in our testing of symptomatic folks at the health service, where this week, just as the same as last week, we're at about 3% positivity. All of our response systems are well staffed and responding at our expected targets, and our occupancy in the quarantine and isolation space is very low. So we're, compared to last year, it's really a night and day at this time of the year. This time last year, we were seeing widespread transmission through the residence halls, and we have no evidence of any clusters right now, while we keep looking for that. And, we're working with the county still, but, in the region, the emphasis right now is more on the K through 12.
Very good. Thanks, Rob. Emily, do you have an update on our testing recommendations as we approach fall break and the beginning of holiday travel season?
Absolutely. So we're doing a lot of planning around travel. First, before I get into the testing recommendations, I wanted to emphasize that for our community, that the CDC still recommends that unvaccinated individuals do not travel. It's discouraged for people that are not fully vaccinated. If people who are not fully vaccinated do choose to travel, we are recommending you get tested 1 to 3 days prior and get tested when you return at the 3 to 5 day mark. Basically, what this is going to mean is 2 tests the week before you travel, 2 tests the week that you come home from traveling for people that are not fully vaccinated. For people that are fully vaccinated, there is not a CDC-based testing guidance if you're traveling domestically, if you're fully vaccinated, but testing is still available to you. So we've got a lot of increased capacity at the saliva testing centers, including a new space next to the CCRB that has more capacity than the Ross location, the Palmer location combined. Please come. So lots of capacity there if you are vaccinated and do want to add testing to your travel pattern. For international travel, the CDC does recommend PCR-based testing. Now, one more thing that we're going to be doing around the Thanksgiving time period and at the end of semester is we're going to be bringing mobile testing units onto campus that will offer antigen testing. We're working with local and state public health partners to make that resource available. So just bring a lot of different opportunities, different types of testing into the area.
Thanks very much, Emily. A question that's come to me a lot has been also around testing for asymptomatic vaccinated persons on campus. Some people have suggested we should require people to be tested weekly, even if they're vaccinated. What's the current guidance and rationale for how we're recommending, making available, or requiring testing?
Yeah, so those are very different things. We have testing very available for people who are vaccinated, tons of capacity. We really encourage vaccinated people to make use of this resource. In terms of requiring it on a weekly cadence, what we're following right now is the CDC's guidance for the Institutes of Higher Education, which specifies they have a section of that guidance for vaccinated people and institutions with a vaccine mandate policy. So we're following those specifications that say that fully vaccinated people don't need to undergo required routine screening testing. Now, we're continuing to track cases in vaccinated versus unvaccinated people. We're watching that, and we've done this in the past. We can do this in the future. If we see concerning situations, if we see clusters and we need to increase testing of both vaccinated and unvaccinated people around certain situations, we certainly have the capacity and the ability to do that.
Good. Thanks very much, Rob and Emily. Dr. Milani is traveling today, so I get to pull double duty, and I'll bring in leaders from our community to address additional questions that have come in the last couple of weeks. First, I'd like to call upon Provost Collins. Good morning, Susan. Thanks for joining. To begin, what is the status of the vaccine incentive program? We're talking now about mandates across campus, but as many people recall, we rolled out an incentive program as well.
Yeah, absolutely. I'm happy to give an update on that. But before I do that, I just wanted to make some very brief introductory remarks, and good morning, everybody. We're 6 weeks into the term, and I do have to say that the importance of the significant in-person engagement, especially for our students, is really increasingly evident. And it's just great to see the continued energy on our campus. It does continue to be a collective effort. And so in that context, I really want to thank our students who are just overwhelmingly working hard to follow our guidelines. I also know this is a really stressful time for them. There are a lot of midterms and many papers. And so I wanted to wish all of you, our students, all the best in what is a kind of intense time of the semester. Thank you as well to our faculty who their clear commitment to our students and just the breadth of the research that's going on across campus is exciting. And also to our staff, thank you very much for all you do to support our mission. In terms of the vaccine program, let me start with employees. The program did wrap up last month, and it was just a fun addition to the ways that we were encouraging people to get vaccinated. And of course, we launched this before the mandate. So a total of 53 faculty and staff were selected to win prizes over the length of the program. And about half of those who claimed a prize claimed a cash prize, and the grand cash prize winner took home $5,000, and about half chose experiences or tickets. And some of those were really unique. So just to give a couple of examples, a weekend with a guest at the university's the biological station, which is on the shore of Douglas Lake. If you haven't been there, it's wonderful, which is at the northern tip of the Lower Peninsula. 1 day a week for a semester of tutoring for a K-12 student. And a private University of Michigan and UMA scavenger hunt for up to 20 people. Those are just some of the examples. A total of 76 students were selected to win a prize. There were thank yous for students who had submitted their status prior to when we launched the program, and that included $500 flight vouchers, $500 gift cards to the U of M Tech Shop or to Barnes & Noble. There were also weekly, monthly, and a grand prize drawing. So those prizes ranged from Amazon and Lyft gift cards to Group X semester passes, and those are for fitness classes, and tickets for U of M athletic events and graduation regalia. So I just want to thank our faculty and staff and students who participated, but especially the group that led implementing this program. So in particular, thank you very much to Janice Gassaway, to Devin Burkhorst, and to Kayla Merritt, as well as the whole team that supported all of the efforts.
Yeah, that did sound fun, but I really want to thank all of the students, faculty, and staff, because as you know, our students are more than 96% vaccinated, or many of our faculty are in the 99% vaccination. Our staff overall is over 90% vaccinated, and this is fantastic. And it's really a big fraction of the reason why we're having a much more traditional and safe semester so far. Provost Collins, were U of M's international students able to return to campus this semester? I know it was difficult for many last year.
Yeah, and there's really some good news on this one. So last year, we only had about 3,500 of our international students on campus. But as of yesterday, so October 7th, we have 6,600 international students enrolled on campus, and fewer than 500 are still kind of navigating to try to figure out their way to Ann Arbor. At the start of the semester, we had 6,100, and then an additional 500 have been able to arrive during the month, this past month. So that's really great news. We've also been able to welcome a number of our international scholars back to campus. And in particular, I'm going to highlight that we have a fresh cohort of UMaps scholars. UMaps is the Universities of Michigan's African Presidential Scholars Program, and we're delighted to have a cohort of UMaps scholars here. It's wonderful both to see our international students and scholars continuing their own education and research and engagement. But I also want to say that the presence of our international students and scholars is so important for our community and our students in particular as well. It strengthens the experience that our students have, allows us to educate stronger global citizens, and really helps them to be better equipped with cultural awareness and a much fuller set of diverse experiences. And so we're really delighted that there is good news on that front.
Thanks very much. Provost, where can students find study spaces, including spaces to participate in a Zoom class or meeting on campus?
Yeah, and of course, there are a number of students who can't necessarily get back to their residence. So that one is important as well. So as study spaces became more challenging during the height of the pandemic last academic year, we were really pleased to develop and provide a central resource to help students identify study sources. And so if you go online to studyspaces.umich.edu, you can see the information that's there. I have to say this was an issue that our student government leaders raised, and it was a pleasure to partner with them to provide that resource. So I'd like to encourage all of our students who are looking for a place to study or participate in their online or Zoom activities with their laptops to go to the site and check it out. There are a lot of sites on campus that don't require reservations. So just to mention a few. So the Michigan Union is open from 7 a.m. to 2 a.m. 6 days a week, and opens at 9 on Sundays. The League opens at 7 a.m. daily and remains open until 11 on weeknights and midnight on weekends. The Pierpont Commons is also open until 11 p.m. daily. Our libraries are open, with Shapiro being open daily until midnight. The libraries do offer a small number of bookable spaces that are conducive to participating on Zoom, and those are available if you go to the library website. And Rackham has also made some spaces available for students who need to participate in Zoom or other online meetings while they're on campus. So in particular, the East Lounge can be reserved for Zoom calls. And the website that I mentioned before, studyspaces.umich.edu, is the best place to go and find out all of that information.
Great. Thank you very much, Provost Collins. I'd next like to bring forward Vice President Martino Harmon. Hi, Martino. How are you?
Good morning, President Schlissel, and good morning to everyone, and happy Friday.
Happy Friday. A few questions for you, Vice President Harmon. Why isn't data about positive COVID cases by residence hall available to the public like it was last year?
Well, it's really important that we protect the confidentiality of students who live on campus and tested positive for COVID. For example, at one point this week, we had only 7 students who are in quarantine and isolation housing, and that's positive. But if we were to make that kind of information public, it's such a small number, we could really risk their confidentiality. Close contacts to students who do test positive will be contacted and identified through case investigation. And as Dr. Martin said, if we do see a cluster, an outbreak in a specific residence hall or area or floor, we can go in and have a testing strategy and really help to mitigate this further spread. The good news really is that our vaccine mandate is really proven to be effective so far. Nearly 99% of our students in our residence halls are vaccinated, and just a small number have approved exemptions. So that's really helping. It's great news. And it just shows that that strategy is being really effective for us. So I just want to thank the students for complying with that requirement.
Thanks. We've benefited from an unusually warm October so far, but the cold is sure to come. So how is Student Life planning to keep students safely engaged as the weather does inevitably turn colder and more events are going to have to move indoors?
We are certainly planning, and we have a lot of experience last year on how to increase student engagement when the weather is cold. But we've had some good examples this fall. For example, the Glass Animals concert in Chrysler Arena, which was a lot of fun and students really enjoyed, but that was safely held indoors. Masks were required. Students had to be vaccinated and follow the protocols to be admitted. We had a program called Escapade in the Union, and again, that was a very safe indoors event. And also the start opening for Latinx Heritage Month was in the Union in the ballroom, and that was an excellent event and a very safe event. So we've had some opportunities to practice and to get some experience. And again, I'll say that our excellent vaccination rates have really helped a lot. But we will continue, particularly when it gets cold, to offer a mix of some in-person, some hybrid, as well as in-person, as well as a mixture of online events so that we can meet students really where they are in a safe way. And those events can be found at events.umich.edu. Personally, I'm planning to check out the Haunted Bell Tower on North Campus. I'm a little scared, so I'm hoping that Dean Gallimore will join me in that. And unfortunately, I missed the pumpkin spice and carving event. So I'm looking forward to the haunted bell tower. That should be a lot of fun. And I want to also put in a plug for students to receive the flu vaccine. That also will help keep the campus safe, particularly as we get into flu season and the weather gets cold. I'm actually planning next week to get my flu shot.
That's great. Yeah, I heard there's a surreptitiously obtained video of you dancing at the Glass Animals concert circulating somewhere on the web. So we'll see if it shows up.
I'm trying to destroy those if I can.
Vice President Harmon, what are your impressions of the student experience now that the semester is really in full swing? And this is your second year here. Your first year was just a very atypical COVID overwhelmed year. It's different now. What are you seeing?
Well, I really identify with the second year students who had a really challenging first year, and it's been a lot of fun this year to get out and enjoy all that the University of Michigan has to offer. So things are going well so far, and students are expressing a lot of excitement and appreciation for all the opportunities to connect with other students, with people in person, and we're seeing a huge turnout for events on campus. But at the same time, some students have shared that they feel exhausted from both the ongoing effects of the pandemic as well as the adjustment to being back in person. So I want to say to those students, you're not alone if you're feeling a bit burnt out and adjusting from the normal experience after being virtual so long, and that's okay. It's also okay not to say yes to everything. You certainly can take some time to yourself to really think about your own wellness and just shut down every now and then if you need to. And we will continue to offer wellness opportunities within Student Life, whether it's through Wolverine Wellness Coaching, peer counseling and CAPS, or events that support well-being. For example, next week, We have an event called Wellness Wednesday. And then on Thursday, we have Taking Care of You. And those are both at the Michigan Union. And students can find information about events at events.umich.edu. So lots of things to do for self-care. But I do want to acknowledge that some students are feeling exhausted. And we're all looking forward to fall study break coming up October 18th and 19th.
That's great. And the last question, Martino, where can someone get more details about the upcoming Parents and Family Weekend?
So we're really excited about welcoming University of Michigan parents and families to campus this November. Parents and Family Weekend is November 5th through the 7th. And there are a number of different opportunities, whether it be information sessions, open houses from the schools and colleges, tours, historical tours, Student Life's traditional Parent and Family Weekend tailgate. I can't wait for that. And of course, the home football game. You know, tickets for the events that required tickets sold out very, very quickly. Matter of fact, once registration opened on September 14th, the tickets were already gone. But there are many events that don't require a ticket that parents and family can participate in. So we really, really encourage people to come to campus, enjoy the free events, interact, just get a feel of the vibrancy of campus that is back. And for the latest information on Parents and Family Weekend, you can check out parents.umich.edu. That's parents.umich.edu. There are FAQs on that page, information about really everything that's happening. And if you have questions, you can email at parentsweekend@umich.edu. That's parentsweekend@umich.edu.
Thanks very much. That's great. And thanks for joining us this morning, Vice President Harmon. Next, I'd like to invite in Professors Martin and Eisenberg. Welcome. Hi, Marisa.
Hi.
As we've shared in a previous briefing, one of the layers we're employing to protect health and safety is wastewater monitoring from campus and near campus. That word wastewater is interesting. It's a polite way of saying sewage, I think.
Yep.
But coordinating the data from this important effort are Professor Martin and Professor Eisenberg. The two main groups working on this project are Wu Ji's lab and Kevin Baker and Krista Wigington's joint lab. The groups are based in our School of Public Health and out in our College of Engineering, and we really thank them for this interesting effort and research that has immediate and practical benefits for us. Can I ask the two of you to discuss the wastewater program and what we're finding?
Yeah, absolutely. So I guess like maybe just as a quick introduction, since probably many people aren't familiar with this as a monitoring tool. So wastewater monitoring provides an alternate way to track COVID in our community. And basically the way that it works is that I'm just going to be real frank, when people use the bathroom, their stuff goes down into the sewage system, and then it moves through the sewage system. And basically researchers can take samples from either the sewage system as it's kind of aggregating from various buildings, or at the wastewater treatment plant, and then test those samples for COVID or for SARS-CoV-2, the virus. And then we can track trends and normalize that data and try and understand what does that mean in terms of the transmission in the community. And so you can do this at a spatial scale from like building level, which is what Wu Ji's group has been doing, and all the way up to community level. And so Kevin and Krista's group has been working on that scale. And there's a state-funded network of labs across the state that have been tracking this. And so I don't know if we want to dive right into the trends. We included a couple of figures here. I don't know if I should just jump right in. Yeah. Okay. So basically, what you can see here. So we included this slide because we wanted to show sort of some of what we've been seeing, what these two groups have been seeing in their research as they've been tracking this. And so the top panel here is the building level wastewater monitoring. And so here what you can see, the color indicates how high the concentration was, and each row is a site that they've been tracking. And so there's off-campus sites and on-campus sites. The off-campus sites are targeted around places where there there are a lot of students, so like big student apartment complexes, fraternity and sorority areas, that kind of thing. And then the on-campus sites are a number of residence halls and different buildings across the campus. And so what you can see here is that it reflects the pattern that we've been seeing in cases, over the course of the semester. There was sort of an initial increase, and then it's been declining since then. And so that's good. It's showing us how wastewater monitoring can provide sort of another way to triangulate on what's going on in the community. And the bottom panel here is looking at the community level wastewater monitoring. And so this here, what we can see, they're tracking wastewater at the Ann Arbor and Ypsi wastewater treatment plants. And so what you can see here is there's actually kind of two different patterns going on. So the county has kind of gone up and has been at a plateau for a while that's starting to increase now. But what you can see is that for Ann Arbor, it went up and then it's actually been coming down, sort of reflecting more of the campus pattern. And so you can see that decline there in Ann Arbor, but Ypsi has basically gone up and sort of plateaued and might even be starting to tick up a little bit, which is really reflecting the sort of county-wide pattern that we've been seeing. And so this basically gives us another way, another angle to track COVID in the community. And the nice thing about this as an approach, I mean, it's still in development. We're still kind of calibrating how this works and how to translate this into epidemiological risk and epidemiological, sort of understanding. But it gives us another way on top of cases and positivity and all the other things that we normally track to keep an eye on what's going on with COVID. And it's a way that's not dependent on testing or people showing up for testing, right? You can just measure this in the sewage. And so, so it has that advantage to it. So that's nice. Sorry, that was a big, long thing.
No, it was really interesting, Marisa. Professor Martin, how does this influence the work of the CHRC as you get together and think about the status of the pandemic on campus and whether we need to do anything different or whether it's steady as she goes, or how do you use this information?
Yeah, so one of the big challenges is as testing behavior changes either because of our policies or because what people do, how we think about percent positivity and some of our other metrics, we have to continually keep that into context. So this gives us a sense of what are we missing, and is there other things? And so what you can imagine is a future where if something shows up in the wastewater data that isn't showing up in our other signals, because we've got these other, we've got all of these imperfect streams of information that we're triangulating across. And it could prompt us to go deeper into, one scenario or another and maybe do more testing in a certain group of people to try to figure out if there's something that we might be missing.
Mm-hmm. That's great. Well, thanks very much. This is incredibly interesting work that really is just a whole nother angle on what the disease is doing across campus. And I really like the fact that it doesn't require people to do anything other than flush the toilet. So that's very good.
Yes, exactly.
Good, thank you. I'm next going to bring in Professor Adam Lauring. Adam, thanks for joining us. He, as I mentioned earlier, is a professor in the medical school as well as in LS&A. And along with Professor Martin and other colleagues, he's the co-author of a paper, Genomic Surveillance Reveals Little Spread Between a Large University Campus and the Surrounding Community, that, congratulations, just this week was accepted for publication. So I thank him for joining us today to talk about this work. And a great small world story, Adam's brother, Josh, was a PhD student in my lab back at Hopkins quite some time ago. So it's almost looking at Adam is like looking at my former student as well. So welcome, Adam. And congratulations on this work, and talk to us about it. Tell us the significance for how we think about the role of our campus as a good neighbor in the community.
Yeah, well, thanks for having me. In August of 2020, which seems like forever ago, we contracted with the CDC to perform genomic surveillance of SARS-CoV-2 to try to understand how COVID-19 spreads on a university campus and how that relates to cases in the community. So with the help of our partners at UHS and Michigan Medicine, since then we've been sequencing all positive test specimens, or nearly all, from these locations. And the basic idea of the project is that if people are linked by transmission, then the sequences of their viruses will be similar. So then you can use these sequences to track transmission chains and clusters of the virus. And when you sequence a large percentage of the community, as we've been doing, you can organize these sequences into a tree to visualize the relationships, sort of like a family tree where you have ancestors and descendants. And that helps you understand how a virus is spreading through a community such as ours. And so in our study, we sequenced about 1,600 viruses over the fall term. About 400 or 500 of those were from students presenting for testing. And then the rest from people showing up at Michigan Medicine for their testing or healthcare. What we found is that early in the fall, there were over 200 new viruses that came in to Washtenaw County. And those viruses circulated widely among the student population, both in residence halls and also on and off campus. But the interesting thing in our study is we found that while these spread quite widely among the student population, there wasn't much spillover or spread to the non-student population in the community. And many of you remember from last fall, there was a surge of cases on campus in October, late October. And then several weeks later, we had the large surge in Washtenaw County and across the state of Michigan. And very few of the viruses that were on campus early in the fall showed up among cases later in the fall. So, what stayed among the student population largely stayed there. And importantly, this wasn't a contact tracing study. So we were not looking at individual transmission events. And so we're not excluding that things like that happened. But our sampling was good enough to say that transmission in the student population didn't really drive increase in cases in Washtenaw County or across Southeast Michigan within kind of the Michigan Medicine catchment area. So we're still analyzing data from the winter term, but the results are qualitatively similar in terms of the relationship between cases in students and cases in the community. So it's been a very interesting area to look at, and we continue to do so.
I think those are really important results, Adam. It need not have turned out that way. It could have been we discovered the opposite. But in looking backwards, I think it reinforces the idea that students tend to socialize and have close contacts with one another, and less so with members of the community that aren't students, and then probably vice versa. So although in effect we're dispersed with one another as neighbors, those close contacts are occurring separately in the two different groups. And that's a bit of a relief in terms of the university's responsibility for also helping keep our surrounding community healthy. So that's great. What's next in this project?
Well, this project was a 2-year contract, and so we're continuing through this term. Thankfully, we don't have as many student samples to sequence. And I should note that we're doing this, we share this contract with the University of Wisconsin-Madison. So they're doing a parallel study there. We've shifted our focus a bit to look at what's going on campus, but also looking at vaccinated and unvaccinated individuals, and are the viruses different among those people, and also seeing if we can use these data to try to understand how much transmission there is in vaccinated populations versus unvaccinated populations moving forward.
Yeah, that's great. That's exactly what I was going to ask you. So I really look forward to hearing what you all learn in the months ahead. So look, thanks very much for joining us today, and congratulations again on an interesting and important paper. I would like to invite in our next visitor. The theme of this year's DEI Summit is Parallel Pandemics, Addressing Structural Racism in the Age of COVID-19. So I invite everyone to participate in the summit events, and I look forward to speaking at Monday's Community Assembly. Here to share more about this important theme and slate of events is Katrina Wade Golden. Katrina is the Deputy Chief Diversity Officer and Director of Implementation for the Office of Diversity, Equity, and Inclusion. Thanks for joining us, Katrina. Tell us about the summit.
Thank you so much, Mark. I'm happy to be with you this morning, all of you, and excited to share some news. This year's summit marks our annual and second all virtual DEI Summit Community Assembly at the university. The DEI Summit provides an opportunity for the university to highlight our efforts and our progress that we've made over the previous year, the changes we are experiencing across campus, and the need for continued action and engagement. The virtual DEI Summit Community Assembly and discussion will take place on this coming Monday, October 11th, from 10 to 11:30 a.m. This year's summit theme, Parallel Pandemics, Addressing Structural Racism in the Age of COVID-19, provides a time and a space for the campus community to come together to explore and better understand the disparate impact of COVID-19 and the linkages to structural racism. While each is a separate and uniquely complex, the interwoven nature of structural racism and COVID-19 underscores the reality that if we are to solve either of these issues, we must address both of them. So joining us this year for our keynote at the summit is Soledad O'Brien, an award-winning journalist and entrepreneur. We'll also have an impressive panel where we're having a featured panelist, Valerie Carr, who's a renowned civil rights leader, lawyer, and best-selling author. The panel will be joined with a number of a faculty member, a staff member, and a student member. So we are really happy to invite the campus community to join us in this very important event. Next slide, please. So while the summit is taking place in the community assembly, I should say, is taking place in the morning, in the afternoon, we will have a community recognition festival. And this is an opportunity for us to come together to acknowledge as a community the work that has transpired across the first 5 years of our DEI plan. The event will be taking place from 3:30 to 7 o'clock at our Trotter Multicultural Center. And here is an opportunity for us to come together, and it's an open house style event to recognize our many achievements. We'll be having many student performances, there'll be refreshments, giveaways, and again, just an opportunity to have some fun and to fellowship with one another as we reflect on all that's happened over the first 5 years. Overall, this year's DEI Summit is special because it also marks the beginning of our transition from the first 5 years of our DEI strategic plan, which we refer to as DEI 1.0 to DEI 2.0. So as we continue DEI efforts campus-wide, this year we will conduct an evaluation of central efforts, as well as efforts in all of the 50 units across campus to evaluate our initial 5 years. Next year, we'll engage in planning for the next strategic plan. And in the fall of 2023 is when we will launch DEI 2.0. So I encourage all of you in the campus community and the broader community to attend the DEI Community Summit, Assembly and Discussion, as well as additional events throughout October. And I'll note that as with all events within the Office of Diversity, Equity, and Inclusion, or ODE, we will attend to accessibility issues by providing captioning, card reader services, and additional accommodations by request. And while a number of summit events are virtual this year, a few are in person. So if you have any special needs for any additional accommodations, please feel free to email us at odei-info@umich.edu, odei-info@umich.edu. So thank you, and we look forward to seeing you at our DEI Community Assembly on Monday.
Thanks very much, Katrina. Yeah, I'll give a special shout out for this Community Recognition Festival as well. Those of you that haven't seen the new Trotter on State Street, although it's been around for several years, a big hunk of it's been pandemic time. So I really invite you to come by and see the energy in the building. It's a gorgeous building, and the students have really settled in. There'll be great performances and a fun period of time to just recognize the accomplishments of our DEI work. So I think that's great. Can I invite our others? So I'll tell you, please take down the questions, John, and then bring in, the rest, and I'll just call on folks and read out the questions if that's okay. Very good. So the first question's for Rob and anyone else to chime in. What's the current status and recommendations around the booster shot that we've been hearing so much about for U of M students and faculty and staff?
Yeah, and that's the good news about the booster shot is that the supply chain is strong right now for vaccine availability. The less good news is that the current guidance is only for folks who received the Pfizer vaccine. That's going to change real soon, and I'll talk about that in a minute. But for those who were vaccinated with Pfizer, the current recommendation is anyone who's significantly immunocompromised. These are folks who are organ transplant recipients or on immunosuppressant drugs. If they were vaccinated 30 days out, they should be getting a booster shot. The second category is for, there's actually 4 groups. 2 of these will say should get vaccinated, and the other 2 can get a booster shot. And those who should are people over the age of 65. And we're doing a lot of that in primary care right now, doing the booster shots, because that's a group that 6 months out, that's the provision, over 65 and 6 months out should get vaccinated with a booster if they receive the Pfizer vaccine. The other is over 50 with a long list of chronic health conditions. The permissive groups are those who have high risk occupational exposure. And this is particularly healthcare workers, where we're starting with Michigan Medicine this week that reopened up the mass vaccine station at the Ford Auditorium at the main hospital there. Or they can receive it at any of the community-based pharmacies, or anyone over the age of 18 with a chronic health condition. So that's the permissive groups. What's coming down the pike just in the next couple of weeks are the FDA advisory boards are going to be meeting October 14th and 15th to talk about the other approved vaccines, the Moderna and the Janssen vaccine, to discuss indications for potential boosters in those groups, as well as a mix and match strategy for those who perhaps had one vaccine and now get boosted with another. The ACIP, which is the advisory board to the CDC for vaccine recommendations, is also going to convene at the very early part of November to consider children. And that's a really big chunk of the population that's still unvaccinated. So I think that's exciting as well.
Good, that's very good. Martino, what is Student Life doing to alleviate the impacts of the student employee labor shortage? I know, you've mentioned to me that we're down in terms of employees in our food services and other places around campus, and we rely on students for so much of this work.
Yeah, the labor shortage certainly has impacted us on campus with student employees. It's a real challenge, particularly in dining and housing, with housing mostly the male centers, the male community centers. And we normally employ thousands of students. And students have experienced early in the semester some delays in being able to find a seat with their friends, just because we need to turn the tables around quickly, and the shortage of labor makes that challenging. And that's usually at peak times at 9 a.m., 12, and 6. But I'm really pleased to report that since students' schedules have sort of settled in, and they're not all coming just at the peak times, we've been able to manage that pretty well. We are employing several strategies to increase student hiring, whether it's looking at the hourly wages, advertising in different places that we would normally not advertise in. And we're just trying to do all we can, especially as now the students are getting more settled in their schedules. They may realize that they have more time for a part-time job. And so we're working on that. We have filled a number of the slots in the mail rooms in the residence hall, so that's really encouraging. But we need more students without question for that. And dining has seen a slow and steady increase in the number of student employees, but we're going to keep pushing, and we'll look at alternative ways to deliver packages to students and just try to be innovative and creative.
Okay, next is a question for either Dr. Ernst or Dr. Martin. Have there been discussions of getting rid of the indoor mask requirement with so many U of M community members vaccinated?
Well, yeah, the CDC has guidance on this, and the state public health department has advised us. It's been based upon the extent of vaccination within the community, as well as the amount of community spread. So we had a period of time earlier in the summer where we were able to relax some of the masking for vaccinated individuals indoors until the rates climbed above substantial and now high levels in the community. And I think those are going to be the metrics that we'll continue to watch to advise on this.
Emily, what's your crystal ball say? Is there a unmasking period in our future, or is it steady as she goes?
Yeah, I mean, the numbers that the CDC uses to make recommendations on this are at the county level, and at the county level, we've really plateaued at this high level, maybe even some slow increases. And we really need to be mindful of, we have kind of created this low incidence bubble on campus, but we do need to be mindful of the infection pressure in the county around us. And so following that level, we may be high through the winter. I mean, I wouldn't be surprised if we're going to have to stay the course for a few months.
Yep. And, to me, things are going so relatively well on campus right now. And even, with numbers of student cases in the 30s, that's out of 50,000 students. But, despite that, I think it's really important that everyone have confidence that our classrooms in particular are as safe as they can be. And I think masking helps that. And there are a small number of unvaccinated people and people that have gotten excused from the vaccination requirement for religious or medical reasons. So, keeping the masking on for now, it also seems very prudent, even though things are going well. A question came in, could you please inform us of whether or not there are specific guidelines currently in place designed to help reduce the spread of COVID pertaining to serving food and meals at events hosted by departments and units across the university? Should we only serve box lunches to go, wrap snacks, etc.? It's actually a great thing that colleges and schools and groups across campus are starting to get together socially. It's one of the things I think that we were missing most in the last year. And, food is often a component of those things. Our environmental health and safety departments provided a set of guidelines for how to safely host events with food. So I'll put those up on the web where we post the video from this morning's session so everyone can take a look. But the basics are that pre-portioned and pre-packaged items are preferable, such as box lunches or box salads. Caterers can pre-package most anything, entrees and all the way down to cookies. I've had a lot of pre-packaged Block M cookies in the last week or so that would normally be served on a buffet. And EH&S has further details that we'll provide for everybody. The last question that has come in advance is the CDC or anyone else tracking how many breakthrough infections are happening? Emily, could you consider, this issue of breakthrough and how frequent they are and the relative protection of the vaccine compared to being unvaccinated?
Yeah, absolutely. So there are a few different scenarios in which people are tracking case rates in unvaccinated individuals. So this is happening locally, at the state level, and at the national level. Here locally, when we track it, we're still processing stuff, numbers are still coming in, but typically we're seeing that the rate of cases in vaccinated individuals is about 3 to 4 times lower than the rate of cases in unvaccinated individuals when we look at that comparatively. Statewide, so state health officials are tracking this. They're seeing same patterns where very low cases in vaccinated compared to unvaccinated individuals. On the national level, the way that system now looks in kind of this paradigm are vaccine effectiveness monitoring and tracking efforts. And so those reports are coming out. Does the vaccine prevent against hospitalization and death? Does the vaccine prevent against symptomatic illness? Those numbers are continuing to be updated. Here at U of M in Southeast Michigan, we participate in a lot of these efforts. I work on this, Adam Lauring works on this. And so we've got a lot of constant monitoring going on that we're part of.
Anything to add on that, Adam, since you're involved in this as well?
No, I mean, I think it's just important to recognize that there are so many parallel efforts that look at this question in so many different settings. And as Emily indicated at the university, there's a bunch of these. And so sometimes it's hard to, because there are so many efforts, it's hard to see that it's actually work going on, even if there's not one big central effort to track this one problem.
Yep. What's frustrating for all of us that have to, make these decisions and issue this guidance is 5 years from now, we're going to understand this pretty darn well, except it's today that we really have to figure out how to keep people safe and continue, with our lives. All these researchers, it's fantastic that all this research is going on. I just wish we had all the answers now, which we don't. And that's why we have to remain flexible as new science comes out, and recognize that science is a process that is continuously self-correcting. We don't get it right the first time all the time. Rob Ernst, can you explain the procedure that we used when a religious exemption to the vaccination requirement is denied? What are the ways we evaluate religious exemptions?
That's tough, and I think for students, these requests have been evaluated by a group of folks from the Dean of Students office, as well as some representatives from the Clinton Dearborn campus to look at each one of these. And it's a personal written narrative about their deeply held beliefs. There's not a requirement for any external documentation from a religious leader, although that's welcome if somebody wants to provide that. And the reality is that a very high percentage of these have been accepted. Over 95% of the student requests for religious exemptions have been accepted. That's last I checked, about just over 700. So it still represents a small percentage of the total. We still are in the position we're in because over 48,000 students are fully vaccinated. But those who represent, they have received the exemptions are required to test weekly. We have those who have rejected, those few who are rejected are given an opportunity to adjudicate those or to get vaccinated. And we're working with a few hundred students who either haven't fulfilled the requirement for this or for other reasons, and we've put holds on their academic accounts right now. So that's going to become increasingly problematic for them as they prepare for next semester.
Yep, and although a couple of hundred sounds like a big number, when the denominator is 50,000 or so on the Ann Arbor campus, the compliance has been spectacular, and this is really an example of the community coming together, not just to take care of themselves, but to take care of one another. So I think it's great. May I ask another question to you, Rob? Someone said that they received a bill for a COVID test from the University Health Service. What should they do to clear up these occasional, I think, errors in how people get billed for testing?
Yeah, right. Students should not have any out-of-pocket expense for any bills for COVID tests. We've been, at UHS is where we're evaluating symptomatic cases. These are the folks who are going to be most likely to have COVID, and we've been averaging over 900 evaluations per week since the start of the semester. We do attempt to bill insurance for these, the covered benefit, and can offset the costs of the care we're providing. And some we've heard, some of these charges have been erroneously released to the patient portal system that's attached to our electronic record. If somebody receives a bill for a COVID test, students can contact health service and we'll resolve that.
Good, thanks. And I can attest to that because I received a bill for one of the COVID tests that I took, asymptomatic tests at the health service, and it was corrected down the road. So we know that it does happen. This next question that came in, I think, can be both Emily and Marisa. Can you discuss the research that demonstrates that vaccination is creating the lower transmission rates? So we see all these breakthrough cases, and yet we say that vaccination is decreasing transmission. What's going on?
Yeah, so I can speak to some of the emerging science at the individual level, and maybe Marisa can kind of chime in on some of the more regional and ecologic things that we're seeing. So vaccination is, we do vaccine effectiveness studies, and are showing vaccine prevents infection from occurring in the first place. But then the second step to look at if someone does become infected, how likely, and they're vaccinated, how likely are they to pass that infection along to the next person? So we know the way a lot of vaccines are worked is to prevent that second step from that person from then passing it on to the next person. So now, early on, there were a number of studies that looked at the amount of virus that people had in their nose as a proxy for trying to look at that. It's an imperfect method, but it gives us a signal. Those studies had mixed results. Some of them had that there was the same amount of virus. Some of them had that vaccinated individuals had lower amounts of virus in their nose. The real gold standard for doing this is to look at people that are the close contacts of those infected people. So how do the close contacts of vaccinated people do compared to close contacts of unvaccinated? The UK has the best system in the world for being able to do this. The UK has new reports out showing that close contacts of vaccinated people have reduced odds by 63% of infection compared to close contacts of unvaccinated infected people, showing that that second step, that blocking forward transmission, seems to be in hold for the vaccine. We've also seen, Marisa, there's also, I'm gonna bounce it to Marisa because there's been interesting stuff looking at communities with a lot of vaccination versus communities without.
Yeah, so I mean, like we have seen stuff where like there's a lot of research where people have looked at, if you look at community rates of transmission and you look at communities that have higher vaccination rates, there are studies that have been looking at that and have found lower transmission rates in communities that have higher vaccination rates, both across the nation and more regionally. I mean, we're still looking at this here in Michigan. If you do keep kind of track of county by county, you'll see that some of the higher vaccination rate counties like Washtenaw and Leelanau have tend to have, like right now, they have lower transmission rates, but there's a lot of ways that you can have ecological fallacies and issues there. So it's going to take time. I mean, to your point earlier, we'll know the answer to this later, but right now we're sort of still in the thick of it. But yeah, but I think there's nationwide, people have done a lot of work on this as well.
I think we're seeing a reflection of this in our own residence halls, right? So we are seeing cases, but we're not seeing clusters. And those are folks that spend a lot of time around one another. We're not masking in our residence halls. If you live in our residence halls, we've got 99% vaccination. We wanted to feel like home. So the students on average are not masked either, and there's still not clusters. So I really think on a practical level, being vaccinated, even if you're a breakthrough case, you're not as dangerous to others as you might have been otherwise, I think is a reasonable conclusion. Yeah. I guess Emily and Marisa again, is wastewater monitoring always being done for other diseases, or is this a pretty novel thing we're doing for COVID?
Well, so it's an interesting thing. Wastewater monitoring has like a pretty neat history, actually. It got started all the way back in the 30s and 40s. It started off for polio. So we've been doing wastewater monitoring on and off in various places for polio for a long time. And, polio and other sort of like enteric pathogens, people have kind of done this for a long time. I think this is probably the biggest sort of, certainly in the US and certainly for Michigan, the biggest sort of coordinated wastewater monitoring effort for any kind of infectious disease that I'm aware of as far as I know, ever for Michigan, for sure. Other countries have been doing it for a long time. So like Israel, for instance, has had a wastewater monitoring program since 1989. But, I think this has been kind of an expansion of this tool into new areas and new pathogens and new kind of ways of doing things. And so I think it has a long history, but this is also kind of a new frontier. So yeah.
Yeah, thank you. That's really interesting. And look, we're almost out of time. I would like to thank all of our visitors and participants this morning for a really interesting session, but also for the work each of you is doing in real time to help keep the campus safe and to help keep the mission of the university alive and moving forward as we deal with this stage of the pandemic. I'd like to say, although things are going really well right now, I've learned, many of us have learned, that we really have to approach the pandemic with a sense of humility. There are things we understand, and I think there are lots of things we don't understand. This might be the end of the last big wave of the pandemic. It might not be. It's hard to say for sure because we've been surprised for sure. One thing I read in the Times today that was very interesting is K through 12 education is basically open all around the country now, and little kids up to older kids, and it's doing incredibly well. Some have masking requirements, many don't. But very few schools have had to shut down again because of COVID. That's just very interesting. So the cases are coming down in most parts of the country, even those parts of the country that are less vaccinated and less masked, but their levels were much higher and the number of deaths, unfortunately, were much greater in parts of the country with less vaccination and fewer masking requirements. So just to point out, there's a lot we don't understand. Everybody has to continue to be vigilant, but there really are better days ahead. And thanks everyone for their cooperation. Have a great weekend. Be safe, everybody, and go blue.